name is Dr. Kigamwa. I'm a consultant psychiatrist and I'm also a lecturer at the University of Nairobi School of Medicine. Psychiatry is the study of the prevention, identification, and treatment of mental illnesses, it's a field that requires not just treatment with medications, but we also engage with other professionals like psychologists, occupational therapists, and social workers as part of a larger team in managing our patients. The commonest psychiatric illnesses are actually anxiety disorders, depression, substance abuse, and psychotic disorders. These are patients who've lost touch with reality, and that could include conditions such as schizophrenia, bipolar disorder, and other unspecified psychotic disorders. The most common misconceptions actually arise out of the stigma that mental health is viewed by the lay public, but also including some of the medical workers who do not really understand or subscribe to mental illness. A lot of people believe that mental illness arises out of things like witchcraft, curses. Sometimes I hear people talk about generational curses, and that mental illness is not compatible with a normal life, normal lifestyle, even achievement in careers, in family life, in financial dealings, and so on. Psychiatry, unlike other fields in medicine, is a profession that is carried out through interacting with patients without necessarily having to carry out complex laboratory tests. So a lot of the information is generated through observation of the patient, talking to the patient, interacting with the patient, and then also, interviewing significant others, friends and colleagues at work. And so it's not the run-of-the-mill practice of medicine, and quite often you find that there isn't a single patient who is the same as the next patient. And therefore, due to the uniqueness of each patient, there are those treatment challenges that come about as a result of that. The other thing I should point out is that psychiatry it has evolved over time, whereas in the olden days, patients were basically restrained in these asylums and given food and shelter, either to protect them from the society or to protect the society from the patients. This has evolved into a very scientific and very modern practice where we use medications and other techniques that we refer to as psychotherapy, and combine those with things like self-care and so on. So it's different. Whereas in my earlier years as a doctor, I did very many surgical operations. I delivered women, did cesarean sections, treated babies, etc., etc. It is really very run-of-the-mill sort of practice when you need a challenge where you are meeting a patient literally who cannot express themselves, and you make sense out of that, and you treat them, and they bounce back and they're able to go back to their careers and things. I think is a worthy field. I've done this since 1989 when I graduated as a psychiatrist from the University of Nairobi. Oh, it's very difficult to say. As you can see, those are very many years that have been in practice. Of course, you start off as a young doctor. You probably will be working in the public service, and you treat patients who present themselves in public institutions before you then develop your own private practice and career. And so on average now I can see maybe 20, even 25 patients in a day. And this is literally every day of my life. Well, I think this job requires passion. You have to be passionate about what you do with your patients. And so, like I said, each patient is different. And until you've sat with them and understood them, been able to figure what kinds of symptoms they have, where are the symptoms coming from, where do they start? Is this a genetic disorder? That's the challenge that you face, and that's what makes it worthwhile to practice. Oasis Health Specialty Hospital is a specialized unit that handles mental health for both inpatient and outpatients. Me and a group of other mental health specialists, psychiatrists, clinical psychologists, occupational therapists, social workers, got together about 4 years ago and mooted the idea of starting a private psychiatric facility. There are not very many private psychiatric facilities in Kenya, and we felt there was a niche. And indeed, over the 4 years that we've been in existence, we've seen the hospital grow from strength to strength, and we've been able to process and treat a significant number of patients at a very reasonable cost. We pride ourselves in being able to deliver quality mental health care that is informed by science and modern practice. We also recognize the unique location of our hospital, which sits on a property that slants into a valley where there is a lot of greenery and trees and a river that provides a very serene environment that is very therapeutic, and a lot of our patients just love the environment they are in. So highly recommended because it's cost effective, and also very professional staff, and then the location in terms of the greenery and the serenity of the area. I think lifestyle tends to be one of the most important aspects of good mental health. We recognize the importance of exercise and recommend at least workout, exercise, whether it's walking, running, jogging, rowing, swimming, or riding a bicycle, at least a minimum of 3 times a week. And we also would like to say that the activity should be sustained for about 30 minutes. And of those 30 minutes, 20 minutes should be what we refer to as a cardio workout. This is any activity that causes your heart to race, to pound, and for you to get sweaty. So when you're walking, it's brisk walking. We also recognize the role of diet. Eating healthy, I think most people are now moving towards a Mediterranean type diet where we emphasize more of white meat, seafood, and less of red meat. We also want people to eat a lot of green leafy vegetables, and to also include a small portion, a handful of nuts, and a small portion of fruit as part of their diet. We also recommend that individuals avoid sugar, and this would mean things like soda, cakes, candy, chocolate, sweets. We also would like people to minimize the amount of dairy products that they take in, things like cheese, things like ice cream, things like yogurt, eggs, and so on. That's as far as diet is concerned. We also recognize the role of spirituality, that everybody needs a special connection with the higher being, and this does not necessarily mean just going to church. It's a very personal relationship with the higher being. The role of charity, being charitable, helping where you know you're not going to get rewarded or compensated, is another very important aspect of good mental health. The role of substances of abuse, substances like alcohol. We know that there is a general guide about how much alcohol individuals should take, and I think the rule of thumb is for females, 1 unit of alcohol per day, and possibly for a maximum of 5 days a week, and for men, 2 units of alcohol per day, maximum of 5 days a week. And you can't say it's Friday and I've not had any, give me my 10 units. It's not acceptable. The role of other substances. We've seen a dramatic increase in the use of cannabis. Although in the industrialized Western countries, there are people who have already moved laws to legitimize the use of cannabis. We feel in our environment that cannabis does contribute to a lot of ill mental health, and therefore we are not really recommending the use of cannabis. The role of stimulants like cat, also referred to as miraa, and its interaction with mental health. Again, not recommended. We do know that it can cause psychosis, paranoid psychosis. It can interfere with individuals' sexuality. Besides the local effects in the oral cavity, the mouth, cancer of the tongue, the lips, are some that come to mind. Poor oral health, dental caries, and so on, are all complications of use of cat. Cigarette smoking is another one that we know is quite rampant. We don't encourage it. It has a lot of physical ill health, especially in the respiratory system, and again that is something we discourage. Then we have the, um, the opiates, things like heroin, things like cocaine, and now more designer drugs like ecstasy, MDMA. All these are things that can contribute to very poor mental health. I think those are the main things that we can say about mental health awareness. Usually, if you are living with a person with mental health, there will be things that will be pointers to the fact that the person is not well. First, we can start with the biological functions like sleep, appetite, that either increased or decreased sleep and appetite. And with increased sleep, sometimes social isolation, a person wants to stay away from the rest of the family, a person's self-care and hygiene drop off, a person does not want to take a shower, does not want to brush their teeth, and when you go into their room, it's all messy. The person might develop very odd, bizarre behavior like talking to themselves, laughing alone, staring in one place, maintaining abnormal postures, and then starting to claim, to make very bizarre claims like suspecting that they are being followed, they are being watched, they are being spied on, that there are hidden devices in their rooms that are monitoring them, or even just running away and wandering away into the bushes in an attempt at hiding from perceived people who might be pursuing them. So there's quite a variety of symptoms that can present as mental illness. As a loved one, you have to be very sensitive to the fact that you could offend a person who is unwell by claiming they're having a mental health challenge. So being gentle and advising that maybe it is worth going for a checkup could be one way of trying to convince an individual to go for a checkup. Sometimes, needless to say, that method may not work, may not be welcome, and at times we are forced to either coerce the individual into going into hospital or even forcefully taking them into hospital. Sometimes we enlist the help of policemen, we enlist the help of nurses who can come home and sedate the individual and take them to hospital. And of course, a lot of these things sound like they are interfering with an individual's rights. In Kenya, we have something known as the Mental Health Act. The Mental Health Act does provide for these kinds of methods of getting patients into hospital. And there, in the Act, there's a provision for voluntary admission into hospital and involuntary admission into the hospital, which is not just the prerogative of the family, that even when the family brings their loved one to hospital, a doctor must examine that individual and confirm that the individual is not well and will benefit from an involuntary admission into hospital.